Hey, how's it going? This is Danny and Jason reviewing our
Lab 7.
yeah, Lab 7.
Clinician.
We diagnosed Jason with bipolar 2. At first he came in, started saying how he was feeling really down, kind of was leaning more towards depression. So the first question I asked was if he had been taking any drugs or medication or alcohol, since those kind of tend to make people depressed, a side effect of some major medication, and also drinking. But he answered no to all those. And so I asked him what kind of symptoms he was having, and he, answered to like 5 out of the symptoms for major depression.
And hit 1 and 2. I had loss in pleasure of hanging out with the kids, and I didn't say sad mood because as a guy it's sort of hard to say sad mood, and I would think it might be like that in the real world too. We just had an overwhelmingly down feeling, and I couldn't get happy. So we wanted to hit up 1 and 2, most important.
One of the main reasons we just kept asking how long he had these symptoms. He said he'd been having them for about 4 months, which is longer than the 2 weeks that are required.
And for the mood disorders, one, to make sure that the depression did have an effect on the job.
Yeah.
Just because we wanted to make sure, to be full blown under our understanding is that it, would you say
it'd have to affect your job and personal life to the point where you just can't really function normally. You just it just inhibits your life.
Yeah, so wanted to hit that and sort of that key into our full-blown status, and that's basically why we kept digging deeper into the depression and not going into psychosis or anything like that yet, is just to see, how far the depression went.
Yeah.
He'd already lost his job and things like that, so we went to suicide. And
we didn't necessarily ask the chief question, or the questions always asked in order. We just kind of placed them where they fit into our, interview. So after I asked him about all his symptoms and drug use, I kept asking questions about depression. So I asked him if he was suicidal. He said he was veering towards no, but just the point where he wasn't sure, like he couldn't get out of his depression and didn't know how deep it would go. It was a no answer, but it kind of at the point where if he kept going, he might start thinking that, and how it could relate to people who have attempted suicide. Like he knew how they were feeling and why they did that. And so that for me was like, okay, that's definitely full-blown depression, along with the not being able to work or inhibiting his personal life, just to the point where he couldn't function.
As a clinician, would you make me find suicide help? Because I did leave it sort of vague on the fact that I've been relating. So,
I don't know. For me at this point, I wouldn't, just because, I don't know, you seemed really strong on the fact that you hadn't thought about it. So
yeah, totally.
I'd keep an eye on it, but I wouldn't be like, okay, you need to go right now.
Yeah, totally. I thought Danny's 1 to 10 questions I thought were golden. It really gets it gets a point across. Even when you go see a physician, they'll ask you 1 to 10 about the pain. So Danny came up with 1 to 10, how down are you feeling, how pressured, and how guilt. We felt that those were 3 different things, and can really sort of, down is sort of the sadness level. The pressure can be a marker on, his stress breaking point, I guess. And then guilt can be sort of pinpoints towards the suicidal and see where, what level the depression's at, I guess, just basically. Once we realized that it was full-blown depression, that's when Danny started asking the manic questions and some of the other questions that all clinicians ask.
One of the key things that made me ask questions towards manic episodes was that he didn't have a reason for being depressed. It sort of just came out of nowhere. He couldn't pinpoint why he was feeling so sad and just kind of down. And so after I finished asking questions about depression, I asked him if he had any kind of times or periods in his life where he just felt elevated, happier or just felt more confident than normal. And he referred to them as his cloud 9 time. I was trying to make it more where it wouldn't sound like a disorder when he was feeling, I guess, in those moods. And so what he referred to it as his cloud 9 time, where he's more goal-oriented, he's super confident, he's way more productive. But we didn't decide it was a full-blown manic episode because it didn't inhibit his personal life or job.
Mm-mm.
He
Slept okay, worked okay.
yeah.
You know, I sort of kept it at a vague level. Because, you know, who's to say these people that are bipolar, they can have these episodes, especially hypomanic episodes, to where they don't even, there's not cursors on him having to go to the hospital or the family, institutionalizing him, or, loose association speech and crazy impulsiveness. This was more of just, he felt up, like a little grade up, and not enough to harm him or others, but enough for him to get things done around the house. So at some point, those times were good times for him.
Yeah, and he never hurt anyone or anything during these hypomanic episodes. He usually just fixed stuff up around the house, fixed his car. That's mainly what he would do when he had these goals, was just to fix up his house and just to clean up and fix his car and stuff like that. So, and even at work, it would just make him more productive. Even though sometimes he had racing thoughts where he just couldn't focus, overall during these times he was more productive because he just had these goals and he just knock them out and knock them out.
And me and Danny felt that it was best that, how do you say that? Never mind. Never mind. Me and Danny, we both felt that he needed the symptoms. He needed at least 4 symptoms to be at least considered bipolar and have this manic episode. So we had him have 4 of the symptoms, like you were saying, the racing thoughts and the focus and the elevated mood, which is the number 1, and things like that. But we had it at a lower grade and sort of not all the symptoms, just 4 of them, just to make that hypomanic, and then we just sort of left it vague after that.
Yeah. And then after all that came down, after all the depressive and manic questions, I just made sure at the end, I just asked him, during your depressed or elevated moods, have you ever heard voices or seen hallucinations, which would be the psychosis? And he said no. So that's also part of the reason why I was a bipolar too. I never experienced any psychosis. And in the end, he experienced full-blown depression, but not a full-blown manic episode. And so that's why we came to the bipolar 2.
Thank you very much, Mr. Liscombe. Peace out.